All right, starting again. So what we're going to begin with is an overview of what is cost modeling. And I want to talk to you about some simple things that you can do. I think I've done complex cost models with complex spreadsheets with all this detail. And I think you can get lost in the detail and you can feel like the only way that you can do this thing called cost modeling is to hire somebody, spend a lot of money to create you don't need to do that. So, I mean, there may be times when you want to do that, but I want to show you things that you can do that are not so complicated that will help you both make the case for higher rates for infants and toddlers, as well as think strategically about how you might begin to get some sense of the cost of care. This is like an obstacle course.
I can.
Yeah, why don't you
advance
press slides
for you?
So the first point, keep going. Next point. There we go. Okay. So the first thing that's really, really important to understand is that we want to get away from basing rates on the price of care. The price of care and the cost of delivering that care are two very different things. And when we base rates on the price of care, we by definition embed structural barriers. So by definition, the price, so as someone who's looked at market prices for years, I've been at this for a long time. I started looking at market prices way back when the Child Care and Development Block Grant was first passed. So I've been in this a long time. And I can tell you from all my years that the strongest predictor of the price of care is the incomes of the families that live in the neighborhood where the program is located. That is the predictor. So
I think you got to come back here to be on camera.
oh, sorry.
Sorry.
So
Now I can see the shots.
I have to move. I'm sorry. I was a hyperactive child. There's no way I stand here. So basically what we want to do is begin to open the door because so that's a big problem. So the second thing is the price of care is also reflecting what families can afford. So first of all, it's reflecting incomes of families. The second thing is reflecting what they can afford or what they're willing to pay. We all know that the cost of an infant increases dramatically, right? But parents aren't going to handle that big increase. So we're trying to get our arms around this. Next slide. So what I did for this particular piece of work, I'm sorry, but I got it.
Yeah, you
slide.
stand right there. It'll be
Sorry.
fine. There you go. There you go. That's beautiful.
All right. So what I tried to do was to make a case for, because a lot of people don't believe me when I say that the price of care is driven by the incomes of the families and that it's really, you'd be shocked at how little it relates to cost. So I just did this little straw person study, which by the way, all of you can do. It's really simple. So here I took Baltimore City and Montgomery County in Maryland, two counties right next door to each other. One poor or lower income, one high income. So you see median household income, double, right? Look at this, monthly price of care for infant care, just about double. Monthly price of care for preschoolers, just about double, right? Now, what's the median wage for a director or administrator? That sure as heck ain't double. It's just almost as high in that low income neighborhood. And the median wage for teacher, again, I was actually surprised at that. I don't often see that. I usually see that the teacher wages are much closer together, but that's another. So this is all data you guys can pull right out of the Bureau of Labor Statistics, but it makes a clear case. Now, next slide. Now let's look at what actually happens. So they base their rate on market prices in Baltimore and in Montgomery County. So let's look at minimum licensing, right? So at minimum licensing, let's go over to Montgomery County first. So to far right. So here you see that if you're serving 3 and 4-year-olds, you're actually making a hefty profit, right? If you're serving babies, even at the market price, you're covering most of it, right? There's somewhat of a gap. Look over here in Baltimore. And what I love to look at when I look at these charts is this orange bar. So basically, here's a really important fact that many people don't get, which is that the market rate is, the state actually pays a provider, the market rate minus the parent copayment. So what I always want to look at is how much cash is the provider actually getting from the state? That's this orange bar. So look at this is how much they're getting in Montgomery County, 11 grand for a 3 and 4-year-old, 15 grand. In Baltimore City, where everybody's poor, they're only getting 5 grand and 9 grand. The rest they're supposed to get from the parent. So the bottom line is, structurally, this is inequitable. Even if you grows it to market prices, you're still not helping these programs. They've still got this big red bar. And this is at minimum licensing. Now let's see what it looks like at top quality. You want to press the next button?
The slides aren't advancing on Zoom, so.
Oh no, what a pain. So, there we go. Okay, so now look at top quality. So at higher quality, interestingly enough, you're still doing okay with 3 and 4-year-olds if you're in a higher income area, Montgomery County. You got some problems with babies, but oh my gosh, you're losing 14 grand a kid with a baby at top quality in a low income neighborhood. So the point here is, this is not like you can make these simple comparisons without doing cost modeling. Let me sort of walk you through how I did them. Does my next slide show that? Let's just see. Oh, no, go back. Sorry. I'll do that one in a minute. That's another fun one. Basically, what I did here was this, and I'm happy to share my spreadsheets with you, happy to share my methodology. But basically, what I did was I figured out the cost of child by going to this calculator, costofcare.org, and I'm going to show you that calculator in a minute, right? And that's where I got my likely cost. And then with the market price, I just pulled up the state charts and said, how much is the state share? How much is the parent fee? And I compared the two. And so what this does is very glaringly show you that market rates are very inequitable and we need to shift to cost modeling.
Louise, is the quality based on teacher ratio?
The,
Is that what, when you're talking about top quality,
Yeah.
is that your teacher-child ratio?
Well, actually, what I did, and I'll show you this in a minute, Simon Workman developed a calculator that's pretty cool. And you can go on there and you can click, like, what if I wanted fewer teachers?
Okay.
What if I wanted higher wages to rate teachers? What if I wanted, right? And I clicked everything
Okay.
on that list except parity with public schools. So it's all the things that we would typically think of in an early childhood program as higher quality. And I'll show you that in a minute. But I just use that as my proxy, right? Next slide. This is another really easy thing you can do that often makes this glaringly obvious. And I would encourage all of you to do this in your state. It's a really fun exercise. So what I did here was I put side by side the rate bands for reimbursement rates, right? What is the reimbursement rate by age of child for that state? And then I said, oops, go back.
Sorry.
And then I said, let me place this side by side with the licensing ratios, because the licensing ratios are what are driving your costs. So just look at this for a minute and look at how cockamamie it is. So basically, you have to serve at 24 months, you can raise your ratio, right? But here at 24 months, you're actually getting paid $4 a kid less for children 12 months to 24 months, when in fact you have to meet the same ratio. Why? How is that, right? And then at 24 to 36 months. So you see this doesn't line up. This is basic stuff. And it's really, it's often something like what I do when I do this with state childcare administrators is they're like, wow, like I never thought about that. It wasn't intentional. They didn't write the licensing ratios. That was often written before they came there, or it was the responsibility of another division. They're setting rate bands and they're thinking like, oh, here's what a typical provider would charge, not how does the cost of care drive this. So this is something that your state childcare administrator can change often, pretty simply. Because there's not a rule that says what rate bands they have to do. They don't have to go to a hearing to change the rate bands. They can just say, oh, okay, now our rate bands we're going to pay from 0 to 24 months, from 24 to 36. You know what I'm saying? They can align them up with their licensing ratios. And that's actually a way to raise. I have helped state child care administrators raise rates for babies simply by changing their rate bands for ages.
Sorry. And what about?
Hang on one sec. I'm going to bring you the mic because you have to be able to talk into the mic. My apologies for people that are watching on Zoom. I just move around too much. It's just, you're going to have to listen.
What about teacher centers? Because you're comparing reimbursement rate versus ratio, right? But you have one teacher in each classroom. Does the salary start the same for toddler teacher?
This has nothing to do with the salary. How much a salary gets paid is up to the provider, how they spend the rate. This is what the state is setting at a reimbursement rate, and the ratios relate to how many teachers they have to have in the classroom. But how much they pay those teachers, that's up to the individual provider.
Thank you. So the question that I would have is, have you ever approached the state with this and then they've dropped rates? So like, I love the idea of increasing rates. But my fear would be saying, oh, great, we'll save some money and drop rates on, to match.
People can always choose to do things that are counter, but I personally have never seen that happen.
That's what I
I have seen states readjust rates if they feel like that they really need, like when we talk about New Mexico very intentionally raised rates for infants and toddlers and for home-based providers, not for preschoolers, because the cost modeling didn't indicate that they should. This isn't cost modeling. This is just a simple exercise, but it's really effective, by the way, with state legislatures. It's really effective with policymakers because they're like, well, duh, like, why doesn't this line up?
As a state administrator, I just want to say thank you. We are changing our rates right now and never seen or looked at it this way. And so as I don't know, I know that we try to align a lot of things with our licensing. There's a lot in Nevada that is set up that way, but I don't know where those age buckets fall. And so I am going to, at the airport, pull it up and look. So I can know, because that is we can change that tomorrow.
Correct.
So
That's a lot of times this stuff is really hard to change. This is some low hanging fruit, guys. This is something that you can change. Next slide. Okay, so here's another caution. So in the previous versions of the Child Care and Development Block Grant, there was a rule that said the state cannot pay less than what a private fee-paying family pays. And it costs state can pay more, I'm sorry, state can pay more than what a private fee-paying family pays. And that was a big problem, because even if you raised rates, if the provider couldn't raise the rates for all the families in their program, it didn't help them. And so if you're trying to help poor neighborhoods, by definition, you just made a problem. Well, I just want everyone to know that rule is no longer there. And in fact, in our session, I think you even said it. We just had a session around using rates for CCDF. States are allowed to pay more than what providers typically charge now. So that's another really important thing, because you can do cost modeling, you can raise your rates, you can do all these things, but if you still have that clause in there that says the providers can't charge more, then you're still gonna undercut the change that you made. Next slide. Another big beef of mine is what I call the second copay. So childcare rates are based, as I said, the state sets a market rate. They also set a parent copay. They subtract the parent copay from the market rate before they send payment to the provider. That's the copay from the state's perspective. But right now, I don't know, you could probably tell me how many, Elisa. I'm guessing 90% of states. Maybe it's less.
A little less.
A little less. Providers are allowed to charge parents the difference between what the maximum rate is that they charge and what the state's maximum reimbursement rate is. What that means is that thousands of poor families are paying two copayments. And in my opinion, it makes our copayments moot. Like, we based copayments based on what we thought families could afford, and then they're getting hit with a second copayment. Up until now, this has been a real tautology, because states have said to me, well, I have to do that because if I don't, no one will serve my kids. So my answer to that always is, let's get your rates up. So they will serve your children. And so as we move toward cost modeling, as we raise these rates, we need to be very cognizant of this issue. And when we get rates to where they are reflecting likely cost, we need to prohibit providers from charging that second copay. because we've really got to make this affordable for families, and we have to make our co-payments from a policy perspective make sense. So I just summarized a whole bunch of stuff that I've written a lot about. So I just want to let you know, you can go to Opportunities Exchange website, you can see these handouts. There's lots more stuff, and feel free to reach out to me about this. I just wanted to give you a real simple overview. And now I think the next slide is where I want to go. Yes, okay. Now let's see if this will work. Can you click the cost of care link and see if it works live? Otherwise, we'll have to stop sharing and reshare. I want to actually show you these calculators and rates. Can you advance your slides?
Can get back to the slides now on Zoom. There we go.
Oh, okay, here we go. So here, you talk and I'll change your slides.
Okay, so as I told a brief little history before of what has happened in New Mexico, it's been an ambitious couple of years, as it has in many states. But Secretary Graginski was appointed and confirmed in late 2019, early 2020. Of course, then we get a pandemic. We also embark under a Pritzker Children's Initiative grant in a partnership, a public-private partnership, really between Growing Up New Mexico as the recipient of the Pritzker Children's Initiative grant and the new State Early Childhood Education and Care Department under Secretary Graginski's leadership on a cost estimation modeling journey. So we had support from the hub and the cost estimation model team under Capito and Associates, Gina Capito and Simon Berkman, as well as Jessica Rodriguez-Duggan were on that. And we go forth on this cost modeling exercise, basically to determine the cost of actual quality care with all of the different inputs. And it's a model where you can look at the ratios, you can look at the space requirements, you can look at, and it was based on provider input, which was really,
What was it?
so can we go back a couple?
One more?
No, actually, go forward now. So sorry. There we
Got it
go.
on
We
the,
can leave it on
got
that
it on
one.
the side. You have to click in.
And there were a few key elements of this that I would say that were really important, because ultimately we had to ask providers across all categories, all quality levels, to open their books to us in order to determine what the actual cost of care was. And then there were a few things where we came back and we asked them, all right, what's missing in this? You know, insurance and food and all of these costs that went into it. But ultimately, it was really important for the outreach. You know, we've heard a lot of these things. In order to build trust, it became really clear to us that Growing Up New Mexico, as a non-governmental partner who was able to assure the privacy of the data, that it would only be shared in aggregate, that they were not opening up the books to the government was really, really important. We had to repeat and consistently communicate about that. And honestly, that's something where we could have done better because it's a complex thing to communicate. What is this for? Why are you opening your books? Why should you share the information with us? Yes, your data is confidential. We also went through all of the natural ambassadors in our state. And this was really enhanced by the fact that we just created an early childhood department. So we had a lot of people engaged in an early childhood coalition. We've worked hard to maintain that at Growing Up New Mexico. So we go into the rural communities and we made an effort to go through the natural leaders and ambassadors there, as we had done with creating the department and getting people to open their books. Of course, some of the key challenges, home-based caregivers, smaller centers, rural folks that are undocumented, immigrants, Spanish-speaking, you know, all of these trust issues. We have 23 Pueblos, tribes, and nations as independent tribal governments in New Mexico. So again, trust issues really strong, and that repeated clear communication And then to manage expectations and to say, this is what this will be used for, and this is the next step. This is how, and again, we've heard this, I think, a lot at this conference, going back to folks and saying, this is what we did. This is the cost model. It is complicated, but here we go. This is what it became. Okay, keep moving. So some of the considerations, we ended up moving incredibly fast. And again, I just cannot give enough credit to Secretary Kraginski and her team and what they managed in addition to a pandemic while taking on the complexity of this. But the CCDBG application and approval process, the plan that we had to put in place for our rate setting, we had to get approved for what's known as an alternative rate setting methodology as opposed to the market rates. And so this was our rough timeline. We kicked off the cost study really just as the department began full operations in July 2020. We did a bunch of outreach and information sharing. We then, did the data collection, getting folks to open up their books. Gina and Simon did a lot of individual interviews. The analysis period took place in early 2021. And as of July 1, we got a new table of rates that really cover the cost of infants and toddlers, as Louise mentioned, and home-based caregivers got the biggest bump. And that's where 100% of what the cost estimation model included was covered. So we have, in essence, and I believe most of you understand this, but a whole new foundation upon which to build our childcare system with these rates. And the importance of that cannot be overstated, really. So, as Louise touched upon, it's the actual cost of quality, not the market rate. Here's one really crucial thing. When you do this, and we realize this, and, I have to quote Gina Capito, who said, once you do an alternative rate setting methodology, you don't go back. You commit to ongoing improvements. You're not probably going back to the market rate, and the rates did go up in a lot of cases, not in the preschool ages, but ultimately the foundation is there for improving wages and professional supports. And now we have the understanding, we have some language and communication with our policymakers for this foundation of improving wages and professional supports through the rates. So that's where we see it going. We have the foundation and it's better and it can keep improving as we go forward. So as many of you know, as we say for the choir, home-based care is a clear opportunity for us in New Mexico for culturally aligned support for working families rooted in local programs and knowledge. These rates now better support professional home-based care. For the first time, this cost estimation model embedded a salary for the home-based caregiver in the rate. And again, we will continue to iterate and improve. We've also really seen, and I would say this is a space growing up New Mexico has really made an effort to step into lifting up home-based caregivers as part of the early childhood workforce and really trying to say this is crucial infrastructure in communities that we need to understand, spotlight, lift up, and provide ever increasing enhanced supports, until we get to some nirvana where it is easy to be a home-based caregiver and provide quality care and focus on the kids and make good money and all the things that we can imagine. And now we are at a place where we're really trying to build upon this incredible foundation that our state has established and meet our new rates with the support infrastructure for home-based care networks. We've been partnering with Opportunities Exchange as well as the Early Childhood Education Care Department on developing a theory of change for our business development and support throughout the state to align those of us that are doing support work, business development, anything really around home-based care. We're working on a unified theory of change so that we can all understand and continue to communicate and get out there in our communities about how this works and why this is important and how we can lift up a more equitable system of home-based caregivers and, really enhance our infant and toddler care. And these tools, with the help of Opportunities Exchange, through this work on the theory of change, we're really trying to make sure that we have good tools. Somebody in the equity plenary yesterday asked about language equity. That is something we work on all the time. And as many of you probably know, these equity barriers can be incredibly simple, and Spanish language access is a big one in our state. We have many other languages. We want to work on that, but by a basic estimation, more than half of our caregivers are Spanish speakers, home-based caregivers are Spanish speakers. So just having good tools available in Spanish is honestly an incredible challenge, and something that we realize we're just going to have to work on for a long, long time, and keep pushing on every tool to be better and available in Spanish and, accessible, maybe not just through interpretation. We do that a lot. We've been working on a project where we're actually leading some of our presentations in Spanish. I've sat in on the English interpretation. It's not as good. It's harder to understand. An interpreter is an interpreter, not the subject matter expert. You miss a lot of the nuances. So we're really trying not just to provide interpretation, but to provide content in Spanish as well. I think that's about all.
That's. So now we're going to, let's see if we can make this work.
Can I ask a question?
Of course.
Did this increase capacity? Did you increase capacity with these rate increases? Have you seen a change in services for infants and toddlers and more family childcare homes?
That's a great question. The question was whether this increased capacity. And I would say, I'm not sure it has yet. We're still in pandemic reality, pandemic recovery, people having left childcare because of the pandemic and all of that. That is absolutely our goal, and we believe we can. We actually spent a bunch of time, even last night, talking about with these rates and getting to some simple math, which of course Louise is really good at, to demonstrate, to recruit new caregivers and to increase capacity into home-based care. Right now, we are focused on growing the capacity of existing providers through some of the infrastructure and support, but we're fast seeing that the recruitment of mostly probably new mothers or expecting mothers, as we've surveyed across the board, it's mothers and grandmothers who are doing this. And we see that, with whether we call it the great resignation or the great reshuffle, that there are folks who want to stay home with their kids and maybe would be willing to look at additional income with other kids. So that's sort of the next phase that we get to, but we're still in pandemic stabilization.
Keep answering questions.
Rebecca.
I was just gonna ask that you speak to how this also happened in tandem with a big expansion in childcare eligibility for childcare assistance. And so the question of has it increased capacity, I think, is something that will likely take some time, but it was a big dual effort.
Yes, thank you very much. And what Rebecca is referring to is that we also had, with Secretary Roginski and our Governor Michelle Lujan Grisham, an expansion of eligibility so that for entry, anyone up to 350% of the federal poverty level was able to get childcare subsidy, exit at 400% of federal poverty level income. So we had, coupled with this, a big expansion in eligibility. And, the folks at the state who have also been, of course, coping with staffing shortages and increased demands on what they have to do, have overseen not just this new foundation for rates, but way more people eligible to take advantage of our child care assistance subsidy. And so that has been really crucially important. There's a lot of math going on as to how long we can keep that in place. We hope it will be for a good long time because we have the opportunity with more families eligible and the Heights really do need to work on building the capacity.
Their private pay rates
as the subsidy rates increase?
I think the short answer is no. You know, or if there has been, it's maybe independent of this, because and Santa Fe, which is where we live, the capital, is a good example of a community that has some very distinct parts. New Mexico is a pretty poor state, so a lot of people are eligible, but in Santa Fe and in a few other places, we have some real concentrations of wealth. So Santa Fe is a place where what we've seen is sort of exclusively private pay providers, or not, folks who get subsidy and don't have families that can pay the full cost of care themselves. And I don't know if you've anecdotally, Rebecca, seen anything, but I don't think we've seen an increase in rates. Again, this is more about the families that are eligible for the assistance that I think we've seen, you know, the increased income for providers.
I'm sorry, it's still not working, so we got to keep, I'm really bummed because I wanted to show you this. So let's keep going. Hopefully we can get some tech support here.
So, excuse me, we're in Colorado, so oftentimes we will see providers who will limit the number of subsidy families they'll take. Did you see that shift? Did you see an expansion? I don't know if you had that issue in New Mexico, but did providers, you know, someone might say, I'll take one subsidy child because they don't get paid enough. But did you see an expansion of the number of subsidy children providers might take? So sort of, I guess kind of that's still the capacity issue, isn't it? Sorry. So worried about capacity.
And I can answer while I walk back. I think it is about capacity and it's something to watch.
I'm trying to get.
Mostly, I think when a provider is set up and ready to take subsidy, we have not seen them unwilling to take additional subsidy. You know, the bigger barrier is actually getting the approval of the family to match up with the approval of the slot. And once they're proficient with that, I'm not sure we've seen as much of a limiting factor because the rates are limited.
Yay, okay.
So with this model, are these are contracted slots that are set up this way?
I'm not going
Or
back to that.
are they are the families utilizing certificates? And the reason I'm asking, because we are for Nevada, I mean, truly talking with Simon and Jay, like looking at doing the exact same thing. I mean, you're even speaking my love language on theory of change and all of those things. And so we want what you just did. And trying to do it in a way we're planning out that, you know, foreshadowing maybe some of the things that you guys have learned from that. Because we've also in tandem looked at is a contracted slot, even if we're moving toward cost modeling, which we know we need to do. Where does that factor in with the contracted slots versus certificates for giving the providers stability? Does that make sense?
It does. We have contracts that at this stage are still attendance based, so they're not guaranteed over time. And that's something that we're working on through actually a Child Care Next grant through the Alliance for Early Success at making those more stable. At this stage, our contracts are still, you know, full or part-time based on attendance. And something that we've heard from providers is that the stability and guaranteed revenue is really, really important. So we're looking at that next.
Is about funding. How is this all being funded in New Mexico?
So that's a great question, and thank you. And I should say we have, partly because of a lot of work by a lot of great people over a long time, we have had a lot of generosity from our legislature and executive branch in the funding.
If I just.
I think more than half of it is still CCDBG, but we have substantial
whatever they see is-
fund allocations as well as tandem. We also in 2020 passed an early childhood trust fund bill. We created an early childhood trust fund, and we are still substantially, of course, an oil and gas state. So that fund has been doing very, very well. And it was designed, you know, we did the piece of, and sort of moving on, speaking of theories of change in evolving our early childhood system from governance, creating the early childhood department as really the first pillar, We moved then to trying to secure stable financing in an ongoing way. And so that was the creation of the Early Childhood Trust Fund. We're now really digging into workforce, which is even harder than the other two. So there are a variety of different sources of funding, but I think the simplest answer is we have good general fund monies. We are using our CCDBG funds well due to our great administrators, and the Early Childhood Trust Fund has started to kick off significant funding already.
Okay,
You
good.
ready, Louise?
I am ready.
All right.
Yay, thank you so much for your patience, guys. But I wanted you to see these two online calculators that you yourselves could just play around with that will give you a sense of this stuff. So the first one is a calculator that Simon Workman created, and you just go to costofchildcare.org. And basically here, let me put this in here. I can type, but you just type in the name of your state. Hey, who is state? Give me a state. What? Texas. Very good. All right. And then we hit start. Okay. So now in Texas, what you see here is it's already pre-populated. So in an infant classroom at minimum licensing, the monthly cost is $1,254 a year. This is in a center. And then you can say, well, I want to go to higher quality. So I want to know fewer children. I want to increase wages. I want to provide retirement benefits. I want to do make the classroom bigger, more time for teachers to plan. And now my likely cost goes up to $1,800. So what's cool about this calculator is that you can toggle around with different things. You can do it for a toddler classroom. There it shows you the different price for a toddler classroom. So now this is in a childcare center. But what's helpful about this particular calculator is you can play around with different assumptions around quality. So when you saw my bar charts that I showed you before with minimum quality and top quality, minimum quality was this calculator with none of these toggles. Top quality, I toggled everything except pay teachers the same as kindergarten teachers. But you can play around with whatever you want. So it's just a helpful way for you to think. Now, underneath, there is a methodology guide that you can get from them. So you can understand each one of the numbers that's underneath this. But now I'm going to take you to a newer calculator that Simon just created. Both of these URLs are in the PowerPoint, by the way. This is a new one that he created that I really like because it's much more interactive. And so on this one, let me just type in, we're going to select our state. We're going to say Texas again. And here you just select the state from the drop-down menu, Texas. Okay. And then he did this, by the way, during coronavirus to better understand the changes. But I'm going to click pre-coronavirus because I don't want any of the new changes that probably don't even exist anymore that were there from. Okay. So look at this. It's already populated, assuming one classroom for each age group. And it's already populated with Texas requirements for licensing. So here you see that in my model, if I assume a childcare center that has one age classroom for each age, that's a total of 93 children, assuming they were full. Now, salaries. Simon has this pre-populated with wages based on the Bureau of Labor Statistics wages for the state of Texas. But what's cool about this calculator is you can change them. You can put them whatever you want. So let's just say that your director, makes $60,000 a year. You can just change it, right? Let's say you don't have an assistant director. You can take that out and that won't be included in the calculations. So the cool thing about this is you can adapt it. So you want to just see what would the cost be like. You can change those things around. I'm going to go back to my default because I just want to, whoops. Oh, holy camoli, did I screw up? Oh, there we go. Okay. So I'm going to go back to it didn't change my default. I thought it would. All right, never mind. We'll just leave it like this. Then you can add in, he made an assumption about benefits, health insurance. You can take that out. You can add it in. So it's much more interactive. You can add additional expenses. And then at the end, but why is this not telling me a cost per child? Is there something wrong with this calculator? Let me just, that's very strange. Okay, hang on a second. I'm just going to play around with this and see. I don't know what's going on. That's really weird. Usually at the very bottom, it tells you what your cost is. Let me just see. I'm going to switch to another state and just see what happens. What if I go to New York? All right, current salaries. Yeah, okay. For some reason, let me go back to Texas. For some reason, it had this little glitch, but let's see. We'll go back to Texas again. All right. So pre-coronavirus, I didn't change that. I didn't change any of the defaults. I didn't change. So here you see your cost per child at the bottom. And what's cool about it is you can say, so here's my cost per child with the basic defaults. Let's say I want to, let's say I'm gonna double my infant rooms and my infant and toddler rooms. And now look, how does that change my cost per child? So what's cool about it is you could play around with it in lots of different contexts to better understand cost drivers. And it's already got a lot of this stuff built in. The methodology guide, you can get it from, if you, in fact, I think it's right up here. There's a click somewhere at the top of this. Oh, here, see the methodological appendix. You can just click that and it will pop up exactly what's in here. Now, for family child care, doing cost modeling for family child care is really complicated. And the reason it's complicated is because you have to make an assumption. Is this provider full? And then how much of a wage do you want that provider to make? And so what Simon did in this particular calculation is, so he put it for the maximum number of children allowed in Texas to be enrolled as a family child care provider. And then he assumed that the provider in this case was going to earn 37 and the assistant 23. That was BLS statistics. If you click higher salaries, he tries to do something. I think in his methodology guide, that higher salary is BLS at 1.5, something like that. But again, you can type in whatever salary you want. But what you see here is at current salaries with fully enrolled 6 children, the cost per child is $9,600. With higher wages, the cost per child is $11,000. So, and the thing that with family childcare, see, is they don't typically, this is another really interesting thing. And we've been playing around with this in Indiana as I've been sort of helping them think through some new stuff. But basically, we artificially create these rules for family childcare around infant, toddler, preschooler. But the reality is it's a mixed age group. And so part of this is thinking through and so that's why it makes it so complicated in terms of trying to estimate revenue. Like if you can only serve 2 children under 2, and that means you can only serve 4 children, then you have to lower this to 4. So let's say that obviously this is what's allowed in Texas because this is what his calculator is. But in a lot of states, if you have 2 infants, you can't have this many children. You're not allowed. So you might just have to have 1 of that age. And then you see how now your cost has already gone up to $13,000. So what's cool about these calculators, what I like is that it allows me to play around with numbers and just get a general sense. And I know that I'm always pushing the envelope, but I would actually argue that even states, the federal government says you have to have a methodologically sound way of setting alternative rates. This is methodologically sound. Like, I don't know why we necessarily have to do complex cost modeling studies. I would argue that if I were a state administrator, I would say, hey, it's methodologically sound. I use this tool and I made these assumptions. And here we have a state administrator in the back who's going to comment on this.
So we tried that to say, we want to come up with these rates and we use the online calculator. We were told that would not be approved for an alternate methodology submitting with that.
Curious. And did they say why?
It was that we needed to do, like, it needed to be written out, like what that is. So, because we said, well, can't we just use the calculator?
Right.
Like, that's the calculator, that's our alternate methodology. It doesn't need to get much more complex than that. We were truly told, and there may be more to it because we're also on a waiver. So we needed to make sure that we met the requirements of the waiver for doing the market rate survey within that time. And you do have to get approval for the alternate methodology prior to moving forward with it, which then would have really put us in a bind if we were not approved for that. But we were told we could not just use that.
So let's not Lisa. This is a fun session.
Yeah, so the alternate methodology requires that you submit the plan for approval, and it has to be a plan that you can demonstrate has statistical validity and reliability. So just submitting that you went online and used the cost calculator probably wouldn't get approved. What it would get approved for is for a narrow cost analysis.
Right.
So for a lot,
Sorry.
yeah, so for a lot of states, they still want to collect price data. I know DC, they did an alternate methodology, but they told us we still did a market rate survey because we wanted to see what prices were being charged in order to really do our rate setting. So a lot of states, instead of going the route of getting approval for an alternate methodology, are doing their usual market rate survey, but they are really having to beef up the narrow cost analysis, the cost study. And that gets you around having to get that approved.
All right, I'm gonna repeat what I think I heard you say. Because I think this is
And then I have a,
okay, I think this is really important. So what I heard you say is that if a state does a market price survey, which states are currently doing, they don't request permission, but the market price survey doesn't say you have to base your rates on the market price. It says you have to do the market price survey. So I did my market price survey and it said this. I did my narrow cost analysis using one of these calculators and it says this. I'm going to set my rates based on this. And if you do it that way, then you actually can base your rates on cost. Is that right? Interesting. So that is a way for you guys to think about doing this without having to incur very expensive study around and a lengthy study around cost modeling.
so we are in our market rate survey right now. We just had a TA call last week for how to do a narrow cost analysis because we have not done one before the way that we know that we've needed to. And knowing that we want to move away from this process and truly get an alternate approved methodology using truly doing what New Mexico just did. So there is a tool online for state administrators that is very similar to this. There's just a login. You can go and you can kind of play with the numbers. There is also no set way that the state has to do their narrow cost analysis. I could run numbers on the back of a napkin and write that in. That there is no federal requirements. The market rate survey has to be statistically valid. The narrow cost analysis does not. And they are not validating how you did it in your report. They are not reading your market rate survey on the state. We have heard that from the federal level. That's not their role to do that. It's just to show that you did do it. So that's there is a lot of leniency at the state level in how you set those rates. But it would, I mean, that is the workaround, Louise, the way you described it.
Right.
So.
And even there, I think that even if your state isn't ready to make a big jump to cost modeling, but I will actually tell you the good news is I'm talking to a lot of states that are very ready. So I do think we're seeing a sea change here. But if you're in a state that's not, I think you as providers, as advocates, as shared service hubs, absolutely can use these calculators. I encourage you to use these calculators to better understand your costs, to better understand how they're linked, and to sort of put your costs in context. And also you can pull up the methodology guide and you can see what assumptions did Simon make in each one of these categories. So these are really helpful tools for you to get underneath what are some of the things that state child care administrators are using for costs.
So in New Mexico, you did a fairly extensive cost modeling. Is it very different than the results if you went on here and used the calculator? That's interesting. We could look.
It's a good question.
While you're talking, I'll go look. Let's put New Mexico
We'll
in, see what happens.
What the rates say. My off the cuff answer is no.
I would think it wouldn't be.
And that we did, one of the things and we were able to do because we did have this incredible support from Cavanaugh and Associates and Jean and Slavin, including writing the explanation and what they did and being very clear about the statistically significant methodology and the outreach that was done and all of that. There was a lot of effort that went into, because we did need to get approval for the plan before, going off this particular cliff. But one of the things that we were curious about was the regional cost differences, because we have Albuquerque is a single big metropolitan area in Santa Fe. The rest of the state, or in New Mexico, the rest of the state is fairly rural with a couple small cities, Santa Fe, Las Cruces, Farmington. And ultimately, correct me if I'm wrong, Rebecca, but we did not see a great differentiation in terms of the cost of care in lots of different places. There's some difference in wages. That's probably the most significant one, but by and large, there was consideration as to whether there would be different regional rates and that sort of thing. And in the end, no, the cost of care was surprisingly consistent across the state. And
This is family childcare. That's family childcare. It came out to 12.7. I don't know what your rates are. You might know them. And
I don't know, obviously, whether or not the rates that we have in our updated regulatory document reflect the certain assumptions Simon's using there. But for instance, licensed family homes at a capacity of 6 or less, serving an infant is $875 a month, up from $566 per month. So there
right.
may be
So
some.
it's a little lower, but it's getting there. Yeah,
Right,
closer. Yeah.
Well, depending on the assumptions you put in there.
Oh, that's I have 2 infants here. If you put in 1 infant, let's put in 1 infant. And did you say they're serving 6 kids?
This is 6 or less in a licensed family home. The rate for an infant,
Okay, so-
$875.
So let's put in, I'm just going to assume that, let me go back. Whoops, why is this not letting me? Let me change, I was going to change this to 2. There, okay, so we got, why is it 2?
But I also see we're not seeing much differentiation per age group in what gets spit out.
Okay, let's see. So here's, that's interesting.
Yeah.
So there got close, there you go. With 1 infant, bingo. So that's what I'm saying, guys. We are spending a lot of money for these, for these studies when these calculate. So I would love to just sort of, even if the feds say no, like say, hey, wait a minute, we're hiring people to repeat what is actually in these calculators. But anyway, at the very least, get familiar with it as advocates, as implementers, because I think it's a super useful tool.
Louise, can you look at the statewide? There's a statewide button on.
Statewide, what are you saying? Where?
Statewide cost. Statewide cost.
Oh, statewide. Oh, you know what that is? That's an effort for Simon to, and I don't even think it works anymore. It does. He's just saying that if you have X number of slots for these kids, here's how much the monthly cost would be to the state.
Okay.
So it's a calculator for the state to figure out if I wanted to serve X number of children at this cost, here's what it would be. Yeah.
So here's a thought to just throwing thinking out loud. It's possible for the feds to change their mind on things too. You know that. So I think the more we as states can, if we go through this study, that we are truly going to pay money and it is going to take us a year of time and resources to do the exact same thing that can spit out after we were told, no, we shouldn't do it that way. And yes, you can go through this workaround, but if states don't get the support for the workaround, that's the issue.
I couldn't agree with you more.
So let's fix it. Let's fix it. Let's bring it up and say, hey, look, they did this. This is their numbers. This is what this. I called your bluff. Why is that not statistically valid? Because it's the same people doing the cost survey that made the damn calculator.
You're exactly right. I'm with you. I agree.
great system. So my interest in this piece, I mean, the statewide coverage too, from a state who doesn't put any state revenue into the system. And as we start having conversations about how do we do that in Texas, my question is, what would it, what is that gap? We're getting X amount from CCDBG. We need X amount to actually pay at a higher rate, providers make more, et cetera, et cetera. What's that gap? What is our ask? So as we think about what is that revenue source, what is that ask? So that's what I'm really interested in
Yeah,
as
so
well.
you could definitely use this to.
Yeah, to get some of those
to get some of those
numbers.
numbers.
Thanks.
Yeah. And let me just say, as a friend of Simon, who built this calculator, he's very accessible. So you could totally reach out to him, send him an email, say, hey, Simon, I don't understand this, or can you show me the assumption under this? And he'll totally, sure.
So for us, we don't have the state revenue.
Right.
So that's it, but we're doing it anyway, because we're putting it out there. I mean, like you said, it can't be undone. And I think for anybody to make a true bipartisan change in this, you need someone in the state office that is willing to push the boundaries and take those risks to say, we're making these changes anyway, because we need to do them. Prove that it works. Because and then once you move through that model, for you to undo it would be total anarchy. And if you have been the entire childcare system, and that's for us right now, our governor has come forward and said childcare is a priority. Okay, so childcare is a priority. We have everybody listening right now. We have known the system has been broken forever. We now have an unprecedented opportunity. And I feel like, we have to do this the right way. And if we don't just do it, like there's ways, force them to find the money. That's our thought. We are going to take this forward and say, we did this. You said it was mandatory. We have Nevada as a 24-hour working state casinos that is driven by a industry that is disappeared. We have no workforce. You have no childcare without workforce. Okay, push it, make it happen. They'll find the money.
We've started even to talk about in New Mexico, gap. We do it with capital investments. What's the unfunded need?
I think a couple of other things to be aware of. I think one of the other things I really like being transparent around these cost calculators is because you see the wages that are paid to the staff. And you also see you can imagine, I'm a geek. I play around with these things all the time. So I want to know, so what if I boost my teacher wages up and I get rid of my assistant director? What does that look like in terms of my costs? What happens if I change my staffing patterns and I have team teachers instead of, so I feel like we can use these things at a program level to better understand how to programs themselves take the rate that's available and make the smartest choices. So I feel like those of you who are working with providers, who are doing technical assistance, who are playing, I just feel like the more that we better, there's this black box, of like what went into that rate. Now we've got some transparency, and I think we want to play around with that. One other thing I want to talk about. So when you shift from paying on the basis of price to paying on the basis of cost, there are lots of winners. There are also losers. So I want to be transparent about this. There will be programs that are serving only 3 to 4-year-olds in higher income areas that are not going to get a rate increase because they shouldn't. Because their cost is aligned with the rate they've been able to charge and they don't need a rate increase. So when I do these talks, I often show that picture, the picture of the 3 little kids that are looking over the fence in the boxes, right? Equity is not equal. One of the worst things that we've done, in my opinion, is across the board rate increase, cost of living increase for everybody. Because all we did was just raise those boxes for everybody. So now the tall guy gets to see to the outfield and the little kid still can't see over the fence. So we need, and this is one of the things I love about what New Mexico did, disproportionate rate increases by age of child. And in many cases by say, yeah. So, what are you trying to get back to the PowerPoint?
I'm just checking the chat to see if there were any questions.
Yes, I apologize. This has been a real nightmare from a technology perspective. But hopefully by being persistent, we got our point across. I think we have a few more minutes. If folks have other questions, comments, things they want to.
Yeah, we got 15.
Yeah, oh, we have 15 whole minutes. Wow. Okay, is there more you guys want to talk about or do?
I have a question on the New Mexico example. So y'all have, implemented rate increases and everything. I'm curious on like the supply building side, are you also thinking about sort of complementing funding to either improve or develop new facilities for folks who may see, childcare as a more financially viable business, or be an existing provider and want to expand to a new location that they haven't been able to find previously?
Again, I guess I'd say the short answer is yes. And we've been working in particular on a local initiative, some local initiatives and options for cities that have been interested in using stimulus funding around improvements, physical improvements. There is certainly a need for that. Our state government, our early childhood education and care department has been great around health and safety grants. They're not huge, they're about 2,500, is that right? Which can be used for physical improvements, but that is something that we've considered. And right now there's a decent amount of capital money around in our state, and there's some need, but we can't, and that feels so much easier than workforce. And so we are really focusing on the workforce, how we can develop a pipeline, because not only are we facing a current shortage, we're facing an exit of people from the profession. And as far as we can tell, in every lens we look in, there are the pipeline is actually shrinking from the source, not growing. So how we figure out how to support cohorts. We have also passed free college in New Mexico. This was a signature thing for our governor in this legislative session. Scholarships for a long time. The headline of free college is helpful. But we're looking at all those things, and the primary ones are sort of workforce and then retrofitting of spaces with capital funding.
For the early childhood providers that are exiting or have already exited, but it's still their passion, I would really like to see the student loan forgiveness for early childhood, not just in Head Start and federal government, but for the private providers as well. I really do think that would pull back some people to come back into our industry.
Is there a way to, in these cost modeling calculators, to build in hub expenses?
That is a terrific question. And I've actually talked to Simon about that. They're not here now. Well, I shouldn't say that. You could jerry rig it. And I'll show you how to jerry rig it, but it's not really here now. So in the bottom of the calculator, well, let's go back. Child Care Center. So in the very bottom of the calculator, you see additional expenses.
Okay.
So you can totally like create categories in those additional, but you would have to know what your unit cost is, right? Of that, okay. You do. Diane, you do, right. So you could do that. Now, I have certainly talked to Simon about this. I mean, I would love to get him engaged in thinking about that. And I'm actually doing a project in one state right now where we are pulling up their narrow cost analysis. We are looking at what would that cost be. Then we're thinking about what would it take to be a hub. We're taking each one of the services in a hub and we're figuring out what the unit cost would be. And we're adding that back in. And we're basically trying to back into it, trying to figure out so how much would be the hub cost? How much would be so that because we're hoping to be able to craft a contract for slots that would be to a network. So we're going to contract with the network for slots. And in your rate, we're not going to have a separate grant for the network. We're going to have a rate per child. And a portion of that rate goes to the network and a portion of that rate goes to the provider. And it's all based on a unit cost, and it's based on a set of assumptions about what it costs you to run the hub. So is it possible? Absolutely. I've got a couple of states that are really stepping out in a bold way to try it. Maybe a year from now, we'll be able to show that to you. We haven't yet seen it in the calculator, but Simon could do it. I mean, he knows how to do it. It's a matter of somebody asking him to do it. I know, there was something else I was gonna talk about, which is, so let's talk a little bit about sort of going back to business training, going back to being hubs and supporting providers. So when you are in a situation like we are in New Mexico, where we have a good rate for family childcare. Well, we have a good rate for family childcare. And we have providers that are still scared. Like they don't want to raise their salaries, or we have a good rate for infant care. They don't want to raise their salaries. They say, oh no, I can't take a subsidy kid. I think we can take those calculators, sit down with providers and say, look, here's the state reimbursement rate. Let's put it up there. Let's play around with what salary you could afford. Now press the button. Look, you can do this. I think providers need a lot of coaching around the shifting from a scarcity mentality, from a fear mentality into, wait a minute, with a new rate, you will have the capacity to raise your teacher wages. Because to go to your issue about supply, my personal opinion is we got a ton of supply out there that nobody knows is there. Because programs are not fully enrolled, and so they're not maximizing their capacity. They're not really, we don't have accurate data on where all the slots are, where the kids are. So rather than spending a lot of money right now to build new centers, I want to basically go back and say, how do we use the capacity we have right now? And most of the time, what that means is getting staff in those classrooms. And that means raising wages. That means health insurance. That means retirement benefits, to bring you all the way back to our opening session with Rhiannon. So we have to show providers that that is possible. And I think if we as coaches play around with these calculators to show them what is possible, and then say, hey, guess what? We're going to work side by side with you to get the state to pay rates based on that cost. Maybe, maybe. Honestly, the Great Recession is happening everywhere. I don't know. I think it's always troublesome to try to attract staff. But the answer is not building more childcare centers if we can't staff the programs we have now. Other comments, questions? And I don't know, how are we in terms of time?
We've got 7 minutes.
More questions? Done? Want 7 minutes back in your day?
I was just gonna add, I'm from Iowa, and one of the things way back when Simon really first started going and producing this, you were right, he is so approachable. He helped us with all sorts of scenarios. So how to take that, and then he would say, here, I did this for you. So when we needed scenarios, so that was one thing. Another thing that I'm not sure would work for some of you guys, but we have a very, very active early childhood advisory council. So from that federal mandate, our state is, we love it. We're trying to make sure we can keep it. And it's in the way and honor all of the opinions and the input that is coming in. So that might be another way to incorporate this work. If you're having trouble with your leadership, make sure your advisory councils also understand the importance and what it would do in the long run. Because I know as a state employee, my voice is not near as needed or respected. They want my voice for technical, okay, yeah, this is how that would work. But if you are trying to get to sway someone and make sure they understand this isn't somebody trying, it's like the right thing to do. We find our advisory council is the best for that. Find out who would be trusted, make sure we do some, we always have R's and D's that do it. His issues are black and white. So anyway, that was just a comment to kind of, when you're frustrated, that's another group that could help. So
I think the message that we want to leave you with today is that
don't make the word cost modeling be scary. It doesn't have to be scary. All it is basically, here's a set of assumptions and here's the math multiplying those assumptions. There are online calculators you can play around with. Really take the time to understand this stuff because it is going to be the wave of the future. We are seeing more and more states shifting in the direction of cost modeling for rates. And we do need to really move out of this space of market prices. So thank you so much for your patience.